Welcome to the Sterile Processing Review Part 2. Sources are from the CBSPD Study Guide, Quizlet, and Google. It says the purpose. The study of sciences of microbiology, anatomy, and physiology is essential for the SPD technician. It is critical that the SPD techs also have a basic understanding of the concepts involving infection control in order to ensure quality patient care. The SPD tech is often called upon to assist healthcare providers in the selection of the most appropriate products or instruments. The competent technician can demonstrate an understanding of the relationships between medical products and instruments, the knowledge of anatomical structure and physiological functions, for example, how the products and instruments work and for what they're used for, the essential role of infection control and the importance of proper decontamination as related to patient care is essential. Such specialized knowledge is crucial to reducing patient pain and suffering, institutional infection rates, the length of time patients must stay in the healthcare facility, patient healthcare costs, and ultimately national healthcare costs. There are many unusual terms in the life sciences sections, for example, the names of microorganisms, body parts, and medical devices. The SPD technician needs to have good knowledge of these terms. Educational objectives. When preparing for your study, focus on the following objectives. Number one, understand how the knowledge of A&P applies to the work of SPD. Number two, define basic terms and to understand basic concepts of microbiology. Number three, identify and distinguish among types of microorganisms. Number four, identify the different routes of disease transmissions. 5, understand the basic factors in disease transmission to describe the path of infectious organisms. 6, list the body's defenses against infections as well as factors that influence the body's susceptibility to disease. 7, define standard precautions and to describe its relationship to the prevention of disease transmission. 8, understand medical terminology. Areas of required knowledge 10 through 16. It says life sciences is 9% of the exam. So microbiology related to cleaning, disinfecting, and sterilizing. Number 11, factors in disease transmission and modes of cross-contaminations, for example, blood, skin, air. Types of microorganisms, for example, bacteria, virus, fungus, and prions. 13, microbial growth conditions, for example, temperature and humidity. And 14, basic anatomy and physiology. Be mindful, guys, that I took a picture of this straight out of the book. All right. So question 1, decontamination procedures. All right. It says A, reduce the sterilization time needed to reprocess medical devices. B, eliminate all bioburden from contaminated items prior to their being used. C, reduce contamination to permit reprocessed medical devices to be sterilized. Or D, prevent excessive corrosion of metal instruments during the disinfection process. All right, so decontamination procedures. Let's think about this. The correct answer is C, to reduce contamination to permit reprocessed medical devices to be sterilized. Question 2, a patient contracts an infection from an improperly sterilized surgical instrument. This is an example of A, vector transmission, B, an airborne transmission, C, an aerobic infection, or D, a healthcare acquired infection. The correct answer is D, a patient contracting an infection from an improperly sterilized surgical instrument. This is an example of a healthcare acquired infection. 3, coronary artery bypass surgery may be performed on patients with A, colitis, B, endometriosis, C, cholelithiasis, D, arteriosclerosis. This is some medical terminology here. Process of elimination. The answer is D, arteriosclerosis. If you guys get a chance, look up these 4 words briefly on Google. All right. Question 4. All of the following are classified as critical medical devices except A, catheters, B, surgical instrument, C, needles, or D, thermometers. The correct answer is D. All of the following are classified as critical medical devices except for thermometers. All right. Question 5. The function of the gastrointestinal system is to A, supply oxygen to the blood, B, convert energy into nerve impulses, C, remove nutrients from one part of the body to the other, or D, provide the body with nutrients? The correct answer is D. The function of the gastrointestinal system is to provide the body with nutrients. Question 6. A liver biopsy would be performed to check for which disease? A. Human immunodeficiency virus. B. Hepatitis C virus. C. Cytomegalovirus. Or D. Creutzfeldt-Jakob disease. The correct answer is B. A liver biopsy would be performed to check for which disease? Hepatitis C virus. All right. Question 7. The growth of pathogenic bacteria in living tissue is called A. Decay, B. Sepsis, C. Contagion, or D. Asepsis. And the answer is B. The growth of pathogenic bacteria in living tissue is called sepsis. Question 8. Nosocomial infections can be prevented by all of the following except A. Using proper hand washing techniques. B. Maintaining barriers to contamination. C. Following established isolation procedures. Or D. Increasing the patient length of stay. The correct answer is D. Nosocomial infections can be prevented by all of the following except increasing the patient length of stay. The longer the patient stay in the hospital, the more likely they are to come out with an illness that they did not come in with. Question 9. Healthcare workers are most likely to be infected by which of the following agents? A. Hepatitis B, B. HIV, C. Pneumococcus, or D. Rubella. The answer is A. Healthcare workers are most likely to be infected by which of the following agents? Hepatitis B. All right. Question 10. A staff member brings several contaminated trays to the sterile processing department on a cart and requests that replacement trays be put on the same cart. The technician should A. Place the trays on the cart as requested. B. Cover the top of the cart and then place the trays on top of the drape. C. Insert the trays in a plastic bag before giving them to the staff member. Or D. Clean and dry the transport cart and send it to the distribution for the trays. The correct answer is D. All right, so if a staff member brings several contaminated trays to the SPD department on the cart and requests that replacement trays be put on the same cart, the technician should ultimately clean and dry the transport cart and then send it to the distribution for the trays. All right.